Good afternoon, everyone. Thank you for joining us. We will get started in a few seconds. We'll wait for more attendees to join. If you're in the Atlanta area, I hope you are staying warm. It's really cold today. So okay, I think we'll get started if that's okay. Perfect. So welcome everyone. On behalf of the Center for Urban Language Teaching and Research at Georgia State University, I welcome you to the 8th Annual World Languages Week. CULTR, as the center is known, is one of 16 federally funded Title VI language resource centers in the United States. CULTR has created a unique identity around serving the needs of all students and the communities they represent by helping to promote language learning opportunities as part of 21st century global education. Guided by its core values of access, advocacy, outreach, and research, CULTR has gained a national reputation for innovative approaches to promoting access to language education for all students, regardless of their socioeconomic and ethnic background. I am Matias Guerrero-Ayres, French for International Business Coordinator at Georgia State University, and I'd like to thank you for being here with us today for the Global Health and Humanitarian Organizations panel, which I will be moderating with Erika Denman, a student in the GSU French for International Business program. So I know you're all very excited to meet our panelists and cannot wait to get started, but before introducing the panelists, I'd like to address a couple of housekeeping and technical questions. First, I would like to remind everyone that all panels this week are being recorded and will be available after the event. All attendees will remain muted throughout the entire session. Our panel discussion with the panelists will last for approximately 35 to 40 minutes and will be followed by a Q&A with you, the audience. Students may submit questions throughout the course of the discussion and after using the Q&A box icon at the bottom of your screen. If you like the questions you see, you can click the thumbs up to promote this question to the top of the list, and Erika Denman will ask your questions to our panelists. If you're asking a question to a specific panelist, please indicate their title and last name so we know who to ask. We will also be using the chat feature to enter resource links. So please use the Q&A feature for your questions. Are we ready? Now let's meet our panelists. So today we have Dr. Claire Dykewitz, who is a retired medical epidemiologist, Ms. Tandy Harris, who is an independent consultant and managing director at NAK Consultants, and Ms. Jackie Velades, recruiter in the Office of Recruitment and Diversity at Peace Corps. Dr. Dykewitz, Ms. Harris, Ms. Velades, thank you very much for joining us today. Thank you for your time. And before we start our discussion, I was wondering if you could maybe introduce yourself, tell us a little bit more about you, your current or former position, maybe give us a brief overview of your career. And I believe you're all speaking multiple languages, and given that this is the World Languages Week, I was wondering if you could also tell us a little bit about the languages that you speak. So Dr. Dykewitz, would you like to start?
Oh, good afternoon. Thank you. Well, I'm a physician. I trained in pediatrics, pediatric infectious diseases, public health, and general preventive medicine. And in 2020, I retired from CDC and the US Public Health Service after 28 years on active duty. So I had multiple international deployments during my career at CDC. And even before I went to CDC, I had an international elective in Bangladesh when I was a pediatric resident. And so I had the opportunity to learn some Bangla, some Bengali, when I was in Bangladesh. And later, I used French when I was at CDC, when I was deployed to Africa, to Francophone Africa a couple times. I was deployed to Guinea to assist with the Ebola outbreak response. And then I spent 4 years in Addis Ababa, Ethiopia. I was working at the US Embassy there. And I was the CDC assignee to work on preventing mother-to-child transmission of HIV. And I learned some Amharic while I was there. So I was fortunate in that I had the experience of being able to be exposed to multiple cultures and to learn foreign languages, which I found to be a really enriching experience, and which I highly recommend. So today I'm doing some part-time consulting work in my retiree status.
Thank you very much, Dr. Dykewitz. Ms. Valadis, would you like to tell us a little bit more about you?
Of course. So hello, everyone. My name is Jackie Valadis, and I am a recruiter for the Peace Corps. Before my role as a Peace Corps staff member, I was in the Peace Corps prior to this role. I was in Panama for 2 years, from 2017 to 2019. Specifically, the role I had in the Peace Corps was a teaching English, leadership, and life skills co-facilitator, meaning I worked with English teachers at an elementary school, and together we created programming that encouraged students, elementary school students, to want to learn English and stay engaged within the language as an initiative that the Panamanian government was promoting. And that's what I did for 2 years. Really enjoyed my role. I spoke a lot of Spanish. It's actually my first language. It's the language that my parents spoke. So it was great for me to be able to practice it in a way that was every day, instead of, for me personally, where I could easily cop out and speak English with my family in the United States. So that's what I did prior to my role now. In my role now, I do a lot of outreach, trying to bring in different individuals to the Peace Corps and encourage them to see it as an opportunity for their own professional career paths and whatever they take. So I meet a lot of people who speak many different languages via interested applicants, and of course with Peace Corps staff members, because we are present in over 60 countries. And before that, when I was in college, I was studying linguistics and Romance languages. So I've always been tied to a lot of languages, and I got to study abroad even when I was an undergrad. So I'm really excited to be here and to share more about the Peace Corps with you all.
Thank you very much, Ms. Valadis, and thank you for being here today, for taking the time. Ms. Harris, could you please tell us more about you?
Hi, everyone. My name is Harris, and I also was a Peace Corps volunteer way back in the day, 1997, dating. Yeah, so that's where I think my love of language sort of began there. Although I did grow up overseas, I was an Army brat. So I lived in Germany through my elementary and high school years. So German was the second language that I learned. After I finished college, I went to the Peace Corps. I went to West Africa. So I served in Mali. And that's where I learned French. So French was my third language, or my second language after English and German. And then when I returned back to the United States, I finished my graduate degree in the Foreign Service, and did a post in Tanzania. So I learned a little bit of Swahili. Then we ended up in Holland. So I went to the university there and learned Dutch. And then we ended up in Mozambique. And so now I'm learning, well, I have learned Portuguese. We came here in 2010, and I fell in love with the place, and I've been here ever since. And so what I managed to do was, with all of the moving around, with being in the Foreign Service and everything, I decided to stay here and just kind of unpack my apartment for good. So decided to use my degrees, my business degree and my engineering degree, which I got in undergrad, and became a researcher. And so what I do is monitoring and evaluation, and I actually kind of fell into the health field. So I do a lot of work with local organizations, sitting under the mango tree and having conversations with people to learn more about their lives and what makes what I can do for them to make their lives easier by learning their stories. So Portuguese is the language that's now in the top of my head. I can hear the other languages, but when I open my mouth, Portuguese comes out. So that's where I am now, and glad to be here.
Thank you, Ms. Harris. As I was listening to all three, there was a million questions popping up in my head. So this is a good time to remind the attendees that if you have questions for our panelists, feel free to use the Q&A feature at the bottom of the screen. They have fascinating careers, so I'm sure you have lots of questions for them. So let's get started. Thank you to the three of you for your time today. So my first question is, well, as I feel like as a world language educator, and given that this is the World Languages Week, I have to ask you this question. What role do language proficiency and cultural awareness play in your field and in your current position? And how does it play a role in the recruitment process of your organization? We know that being a proficient in a world language is very important in today's global world. But we often hear about culture, cultural awareness, intercultural competence. Let's call it cultural awareness. Are they important in today's workforce, language proficiency and cultural awareness? Feel free to chime in. I don't know if anybody wants to start. Dr. Dykewitz?
Well,
Yeah.
I'm retired from CDC and the US Public Health Service, so I can't speak formally on their behalf. I'm not representing them. I think that in terms of actually being hired at CDC or in the Public Health Service, having language proficiency is not a requirement. However, the interesting assignments I find, or I found in my career, was really helpful to have some language proficiency or to be willing to learn another language, or I think it gives you a head start in understanding another culture. And in my experience at CDC, when there would be outbreaks and things would be happening and they have to make a decision now, today, who are they going to send? If they have a list of people that are jumping up and down, please send me for this interesting overseas assignment, it helps to have some language ability or proficiency, or to say, look, if you assign me to this, then I would be willing to pick up Haitian Creole. I would be interested in picking up whatever language or improving my knowledge, or I at least have some working knowledge of the language or a language that is spoken there. So I think it's helpful. It depends on what you want to do, but I found that it was quite helpful if you wanted to be selected for interesting assignments.
Absolutely. Well, thank you, Dr. Dykewitz. That's very informative. And Ms. Valadis, Ms. Harris, would you like to add anything on the importance of being proficient in a world language and also the importance of cultural awareness? Ms. Harris?
Yeah, I certainly agree with Dr. Dykewitz. It's very important to be able to be able to use the language, especially when you're living abroad. I mean, for me, since I own a company here in this country, in Mozambique, everybody that I speak with is, the language is in Portuguese. So I can't get any of the day-to-day things done in my company without being able to speak Portuguese, and that means, speaking with, government employees, my peers, my own employees, or even clients. And so, being able to be able to understand what they want and being able to express what I can do for them is very, very important, and to be very clear and concise, because it's so easy to become lost in translation, especially when we bring the cultural aspect into it. So I do find that that's very important. Over.
Thank you. I'm sure you have lots of stories about communication issues or interesting and funny stories. Ms. Melades, is language proficiency and cultural awareness important at Peace Corps?
It's so important. Language proficiency, it's not a requirement to join us, but it's something you will have to do to be a great Peace Corps volunteer. The first step of a Peace Corps volunteer is to communicate with others, and you have to do it in the language that is spoken there. It's right. It's different from feeling like, oh, I expect someone to know English. It's no, that's not our expectation in the Peace Corps. We have to come in and, we are guests in this country. And if we're going to partner with others, we have to know the language and the native language of the people we would like to work with. So language proficiency, I would say if you have a background in French or Spanish, is a big plus in our application process. If you would like to be considered for roles where that is the language that is primarily spoken. But ideally, the cultural awareness aspect too plays a big factor. It's not necessary to explore the world and travel to be a part of the Peace Corps, but an element we're looking for is, are you aware that there are differences even within the US, even within, if you're from Georgia or wherever you're from, if within your own community, how do you communicate with others and understand there are differences and maybe different ways of thinking, and you have to behave appropriately and respectfully. So all of those components are elements that we are looking for in the application. It's something you'll be asked for in an interview, and then we expect the person to practice it and come in with an open mind as they're learning a new language and doing their best to integrate into the local culture.
Absolutely, and I love what you said about us being guests in a country. And that's true. We are guests, and we have to be able to communicate successfully with groups and communities in this country or in our own country. So thank you very much for the three of you. My next question is, do you have any advice for students who are in the audience? Some of them may still be in school, some may have already graduated. What are some tangible steps that they can take? And I'm thinking in terms of community service, extracurricular activities that they can take while still in school or after graduation to better position themselves to land a job in your field. Ms. Harris?
I would say if you all have the opportunity to do a study abroad program while you're still in high school, like maybe for the summer, grab it, take it, go. Jump on the first plane you can get on. Because what it does is it really sort of gets you used to being in a situation where you may not understand everything that's going on around you as you're learning the language and the vocabulary. So you don't become so tense in that situation. As your vocabulary is growing, you'll become much more comfortable and much more fluent, and then you won't be so worried about making mistakes. So I definitely think that as often as you can, trying to get yourself into a situation of immersion where you have to use the language. I mean, when I went to West Africa and I landed in Mali, I couldn't ask for a bathroom. Guess what? I had to learn how to ask for it, so you just do what you have to do. But definitely putting yourself in that position will definitely help you until you can actually be there full time, as a start.
Absolutely. I'm a strong believer that study abroad programs or exchange programs are very, very valuable. So I direct French exchange programs at Georgia State. So I know how important they are. Anything else that you would like to add to some tangible steps that students can take while still in school or after graduation to hopefully land a job in your field?
Well, I'd like to
Sure.
say something. Well, I think that I'd like to address the importance of learning a language. It's easier to learn a language when you're younger. It's certainly possible when you're older, when you're mature, but your brain is more plastic when you're younger. And the first language that I learned, a foreign language, I started learning French when I was a kid in school. And still for me, that's the language that I know best. And so I would encourage people that are in school, in high school or in college now, learn at least one foreign language. It's easier now. I also agree that immersion is the best way to learn. Half of life is just showing up. Okay. And what I found at the embassy in Addis Ababa is that there were a lot of Americans at the embassy who had the luxury of not taking a foreign language class, not taking an Amharic class when they didn't have the time, but make the time, really make the time and just go. And it after a while, it will start to get in and it's very exciting actually when you begin to realize that somebody's asked you a question in another language, you've understood it without translating it into English, and that you answered them automatically in the other language without translating it first into English. And that's a really cool thing. So I would say pick up at least one language if you can. And I heartily agree with the immersion. That's the best way. And then one of the problems in learning a language as an adult is that we are afraid of making mistakes. We want to sound perfect. And we are afraid that we'll sound ridiculous if we make a grammatical error or if we mispronounce the word. But this is how you learn. So if you just realize that it's okay if it's not perfect, but the point is to communicate and to understand, and then just go for it.
Absolutely. I could not agree more. As a language educator, I do believe that it's important to learn a language. And also, you're right. Making mistakes is part of the learning journey, and we shouldn't be afraid to make mistakes. And I always tell my students, trying to sound like native speakers is just not a realistic expectation. And we're all making mistakes and we're all learning. So that's a great reminder. Thank you. Ms. Valadis, would you like to add anything or do you have any tips for students and some steps that they can take now to better land a job in your organization?
Yes, so one tip, right, for anyone who is interested in working with the Peace Corps in the future or any related federal agency, I always ask individuals, especially if they're a student, to see what they are really passionate about. It's easy to say, I want to work abroad and I want to help others. But when I ask someone, what are you motivated to do? There's so many different channels in which you could do that. Is it working within health? Is it a specific cause within health, a disparity within health, the environment? So many different ways to address, and advocate for something you are so passionate about. So I encourage individuals, especially if they are students, to find what that is and try to center themselves there and find student organizations on campus or even within the community, how they can get involved in that way. And then once you know what motivates you, typically the major, I always felt like someone's major, if they went to school, usually complements it in some way, shape, or form. So there's always a creative approach to it. You're interested in the environment and you're studying policy. Okay, that tells me you want to do environmental policy in the future. Great. And then using what you have accomplished with experience and an education background, I think that's a driving force to see what opportunities are out there for you within the Peace Corps and with other, of course, agencies. That helps you see, okay, this is what I can do abroad. This gives me a path of the work I want to do overseas. So I agree with the two panels before me. Learn another language, that's a big plus. If you can study abroad, do that. And if you're thinking in a different way, with other people I work with, if they're thinking more domestically, trying to figure out even where to start and how to even figure out what program they may want to do, figure out what you're passionate about. And then if you've taken a language, try to use that to chart your path in the future.
Thank you. Yes, that absolutely. And if you have looking at the time, if you have questions, do not hesitate to use the Q&A feature. We'll dedicate the last maybe 15-20 minutes of this panel to a Q&A with the audience. My next question is, does your organization offer any scholarship or internship opportunities for students? And if so, could you please elaborate? Ms. Valadez, I believe that the Peace Corps offers opportunities. Would you like to start?
Yes. So we actually, this is breaking news here that I heard about this morning. We are offering a new paid internship role to anyone who is a student. You must be an undergrad or graduate student. And I will actually add that in the chat box if I can figure out. There we go. So it will be done on usajobs.gov. Do look through them. There are opportunities for all, and then for those that have a legal background, like law school. So that's an opportunity that's fresh and new, taking applications now. And then, of course, we have a fellowship opportunity or opportunities for those that do the Peace Corps. So 2 years of Peace Corps service, you qualify for the Coverdell Fellows Fellowship, and that is an agreement Peace Corps has with graduate institutions across the US, where pending, of course, you are accepted to that school and program, Peace Corps will cover, and the school will cover your tuition. So it's a great opportunity for those that do the Peace Corps, and now this new opportunity for students. You don't have to be in the Peace Corps to be an intern for the Peace Corps.
Wonderful, thank you so much. So if you have questions about those opportunities, more specific questions, feel free to use the Q&A feature. Do we have any other internship or scholarship opportunities that we would like to discuss with our attendees?
I provided some URLs for internship and fellowship opportunities that are available at CDC. And also there are opportunities at the US Department of State with the Foreign Service. And there's a great work that these various federal agencies do. And there are wonderful opportunities, and there are opportunities for students. So please, I can't describe them all, but I've provided the URLs and I encourage people to check them out. And if you thought that you might like to be a disease detective, look at CDC. If you might like to serve the prevention health service, look into the public health service. And then foreign service officers do great work overseas, staffing embassies and consulates, and facilitating American interests and projects overseas. So I encourage people to look at these resources and take advantage of them.
Wonderful. Thank you very much, Dr. Dackwitz. Ms. Harris, do you know about any opportunities for that students could take advantage of, either in your organization or in your field?
In my organization, no. I have a very small consulting firm and I'm self-employed, so I don't have any internships or anything like that available. However, we did, Peace Corps is present here in Mozambique. So there's that opportunity. And there are a lot of NGOs that are constantly looking for good writers and good analysts that don't have a lot of experience. So like for junior positions, where the work can be done partially in the United States and then partially over here in the country. And those jobs, I have to find the link on that one. I didn't think of that earlier, but there are a couple of websites here. You could probably do Google searches for jobs in Mozambique, and you will come up with all kinds of NGOs that are here working with the CDCs and the UNs and agencies like that. So those opportunities do exist.
Wonderful. Thank you very much. So I think I will move on to my last question before we start our Q&A with the audience. My last question is a little bit more personal. What inspired you to get into your field, into the field of humanitarian aid and global health? And what is the most valuable lesson that you have learned in your career? So I'll give you a second to think about this question, and whoever wants to chime in.
My biggest lesson has been learning patience myself as I go through the learning process. With are also trying to express themselves and are clearly becoming frustrated because they're not communicating in a way that they would like to, because they know that my language ability is not native, for example. So patience and learning. Yeah, I think patience is probably the biggest thing that I would say is the lesson that I've learned.
I would agree with that. That's a very important skill. Thank you, Ms. Harris. Dr. Dykewitz?
I don't know when I first began being interested in global health. It was just always something that was there. I think I was born with it. Maybe there's a gene, I don't know. I think the other thing to remember is that if you go to another country and you think, I'm going to help them, I'm going to be giving, and they're only going to be receiving, it's not exactly what happens. And for me, I found that it was an incredibly rich experience for me to have the opportunity to live in another culture and to learn about another culture, and to learn how somebody else views the world. And to understand where they're coming from. That is a priceless gift. And it's a learning opportunity. And I think for me to have had the opportunity to live in Africa for 4 years, and to learn about another culture, how somebody else saw the world, that was a marvelous, enriching experience for me personally. And I consider myself blessed that I was able to have that. And it was an honor for me to be able to represent my country overseas. But it's both ways. It goes both ways. You receive as well as give your expertise. And sometimes going into a situation we would have, well, this is how it is in the United States, and this is how we would do it. That's not necessarily how somebody else looks at the world, and they may say, well, you think we need this, but actually what we really need is that. And it's like, okay. And so I think it's a very enriching experience to work overseas.
Thank you. That's absolutely, and I love what you said, and it goes back to what was said earlier about we are the guests in the country, and we have to be humble. We're also receiving. Thank you. Ms. Valadez, would you like to tell us a little bit more about a valuable moment in your career, a lesson that you learned, and why you got into the field of humanitarian aid and global health?
Yes, I chose to join the Peace Corps. When I first heard about it, I immediately was drawn to the idea of serving in the Peace Corps because I wanted to work with the people of Latin America. I am Latin American by heritage, and that's where my family is from. So I wanted to, in some way, shape, or form, join an organization or be independently. How can I work to support my community by extension, right? How can I work to empower those the people I come from? And that's what really motivated me to join the Peace Corps, because they already had existing programming and such a robust kind of program and network in country. And it felt like something that could also help put my families at ease that I was going to go to Latin America. And in terms of what has motivated me since then of continuing to work for the Peace Corps has been wanting to ensure that the Georgia I know, how beautiful and diverse everyone is, that reflected within the Peace Corps. I remember in my service vividly, one day, a community member in Panama told me that they saw themselves in me, and that was something that stuck with me of, wow, you see yourself in me. This is something that I wasn't expecting, and I wasn't expecting to have this deep feeling and response to it. And it's something that stuck with me. So I'm motivated to do outreach for that reason, and bring in someone who maybe has never heard of Peace Corps. I meet so many people, and I think there are so many that could be great volunteers if that's what they wanted to do. In terms of a valuable lesson I have learned from being a Peace Corps volunteer and now doing this outreach as a recruiter for the Peace Corps has been the importance of being flexible. Plan A does not always work out, has not always worked out. So it's about how I adapt to that situation quickly after. Okay, how do I take it from here? That's something that is very important to have. If you choose to go to Peace Corps, something might fall through. Okay, then find plan B or C or D. And that's a really important skill set, and a valuable lesson I've taken is to always have backup plans, and it's okay if it doesn't work out the first time.
Absolutely, thank you. So I guess being patient, being humble, and being flexible would be three lessons learned from the three of you. Thank you very much for your time. I'd like to dedicate the remainder of this panel to a Q&A with the audience. I see that we have a couple of questions already. Please continue to ask questions. I will now turn the microphone to Erica Denman, who is a student in the French for International Business program at Georgia State University. She will be asking you the questions from the audience, and hopefully we'll get more questions as well. Thank you very much.
All right. Hi, everyone. I'm Erica. Like Mr. Guerrero said, I'm a student in the French for International Business program, and I'm really excited to be here today. I'm going to go ahead to the second question that I see. Is there a specific memorable moment socially or professionally that included a mistake, misunderstanding, something where you were poignantly aware that cultural awareness is a key? Whoever wants to start.
I tell you what, I feel like that happens to me every day here in Mozambique. The local language here is Shangan, and everybody I run into speaks 4 or 5 dialects languages, because there's 21 different languages here in the country. So Portuguese is the language that they learned through colonization. So that's the common language that educated people speak. Okay, so people who have had the luxury of going to school speak Portuguese. So those who don't speak Portuguese speak one of these 21 indigenous languages, but in the capital city, everybody speaks Shangaan. So I'm walking into the grocery store, and well, it's not a grocery store. It's like kind of a local fruit stand, sort of the supermarket, but it's outdoors. It's an open air market, you know. And I walk up to the lady, and I just start speaking Portuguese with her, and she's just smiling at me and nodding, you know. So I tell her what I want, and then I stand there, and I'm like, so, you know, I need to get my things. I want to go. I want to go. And she's just looking at me. And you know what she said? She was like, "Bon dia." She's like, "Hello, you didn't greet me first. You just walked up and you just started talking to me." And I was just like, oh my God. And it's such an insult to the local culture here when you walk up and you don't greet and say, "How are you? How's your family? How's your dog? You know, how's your kids? You know, how's your day? You know, are you making money today? How's your business doing today?" You have to slow down and take 5 minutes, you know. And I was just so embarrassed. But after, you know, I kind of had to eat that crow, I started going back to her booth every time I went to that market. And she became a really good friend of mine and also a teacher for me of kind of the customs and the expectations, the social expectations. And then she started teaching me her local language. So I'm still, you know, in the process of learning Shangaan, and it's really bad. But, you know, what kind of started out as a very awkward moment turned into a teachable moment kind of down the road. So, you know, I have to always stop and slow down and just make sure, you know, even though when I'm frantic and I'm in a hurry and I'm in a rush, you know, I have to just slow down and just smile and greet. "How are you? How are you doing?" And it's very American of us to just dive right in and just, you know, get to the point, you know. And so having to kind of slow down, you know.
I can talk about Ebola in West Africa. A couple things. So I was in Guinea. I was deployed to Guinea in 2015 for the Ebola outbreak. And there were some areas of Guinea where there was a lot of Ebola, and we were really having a hard time getting the local population to follow recommendations. And we couldn't figure out why were they resistant to following the WHO guidelines. And I was looking at the training materials for the local population, and they were beautiful. They were really clear in French. And French is the language of the educated elite. And so it's great that we had this in Conakry, but in the areas where Ebola was happening the worst were in areas where they did speak French. They weren't educated in French. And so distributing instructional materials in French was not helpful because they didn't read French. They didn't speak French. It needed to be translated into the local language. So that was problem number one. Problem number two is there were problems with so when people die of Ebola, they have very high viral load counts, and they're extremely touching the body of someone who has died from Ebola is very dangerous. And so there are instructions about how to bury someone safely. And there are safe burial teams. And the local people would be digging up the body after the burial teams had buried the person and running off with the body because they felt that it was disrespectful to the dead. And so the local people then would be touching the body, washing the body, and in some cases, they would be exposed to a lot of virus, which is highly dangerous. So trying to understand what was needed in the mind of the local culture of the people locally. What would they consider to be a respectful burial? How could a respectful and safe burial be conducted? So that took some work, and eventually they came up with a policy that the prayers could be said, the imam would come, the prayers would be said at a little bit of a distance, and the burial team then would be putting the body in a body bag and safely burying the person. But they would wait so that the prayers could be said by the family, but at a bit of a distance. So that was necessary to try to assure that the person could be buried safely without infecting the family. And that took a bit of adjustment, and it took a little bit of time.
Miss Valadez, did you want to add something as well?
Yes, I agree with Ms. Harris's experience with that. I've also was told that good morning before I quickly started my message, but mine's is related to even within for me, having grown up, in my visiting my dad's family, and a norm we have when we say bye to someone, oh, okay, adios, it means goodbye in Spanish, right? Bye, adios. So in Panama, when I was training in my pre-service training for Peace Corps Panama, one would think, I was thinking, right? I'm not speaking for others. I thought, oh, I know Spanish. This is going to be easier for me. Not easy, just maybe 1% easier because I may know the language. That was false. The context is always key. And I remember in the community sometimes saying goodbye, meeting community members, adios, and people would ask me, where are you going? And I go, I'm going back to my host family's house. And they go, oh, well, you've been saying adios all this time, so we always thought you were leaving. We say see you later until next time, because every time you would say adios, there were looks of, are you leaving? Are you going back to the United States tomorrow? So that was something that I context was always key. The cultural awareness of, okay, Spanish is a common language, but it's used very differently, and different words mean different things in different countries. So for me, that was very eye-opening. And after I stopped saying that, I would say hasta luego. That means until later. Everyone goes, oh, okay, Jackie, yeah, see you later. So I appreciated that moment that someone took the time to explain it to me, because for me it was so normal to say adios in my own upbringing, but it was different in a different community, and I appreciated someone pointing that out to me right then and there.
Yeah, we appreciate you mentioning cultural context within the same language too, because there's a lot of variety, especially in those languages that are widely spoken. So we've got a couple of other questions. I do want to be respectful of everyone's time. So I'm going to kind of combine them. Is it true that the health field is the most demanding field these days, as in it's the most in demand for new employees? And then did you plan on going into your respective fields, or did you end up there by accident?
I would have to say that in my part of the world here, it's very much in demand. This is a developing country. HIV is rampant, and all of the diseases that are associated with HIV are very much in play here. And as a result of it being a developing country, that means there's not so much funding for, the luxuries of having medication available, or even having immediate access to a doctor the way that we have in America. So there's always a need. And there's so many ONGs here, or NGOs, sorry, saying it backwards. There's a lot of NGOs here that actually do that type of work and try to fill the void where the public health system is lacking to accommodate so many millions of people In the region where I am, there's usually one doctor to every 200,000 people. So you can imagine how overworked these doctors are. Even the nurses who kind of play the role of doctor, except for doing major surgery, are overworked. And so these NGOs are there to alleviate this and to offer services to people who just have no other recourse. So in that sense, yeah, health is very, it's a very big deal. It's a very in field here. So if you have any inkling of going into a health field, be creative. You can come in at any angle. I mean, I came in as a researcher and I sort of fell into mine by accident because I have a business and engineering background. I was able to crunch numbers. And so I fell into monitoring and evaluation, which is very numbers based, and then ended up sort of moving over to the evaluation based, which is more social. So I got to sit more with the people as opposed to behind the computer crunching the numbers from the program results. So I did fall into mine, but I did have a background for the technical aspects of it.
Well, I didn't really think I was going to wind up at CDC for 28 years. That kind of happened. But then the first question, I'm answering these in reverse order. So the first question was, is there more demand for health professionals now as compared to other types of jobs? I don't know. I haven't done a study. I haven't done a survey to determine. I think there will always be a need for people in the health field, but you have to understand also that the health field is huge. Do you want to be someone who provides patient care? That's a clinical role, and that's very different from somebody who maybe works in public health or who works in monitoring evaluation or administration of health programs. So there's a wide variety of ways in which somebody could contribute to working in the health field. So it depends on what it is that you really want to do. For me, I found it useful to get training in clinical medicine. I really wanted to get training in primary care medicine. So I like pediatrics because I thought the pediatricians were the nicer people. And I wanted to work with them, and I like kids. So I thought, okay, that's an easy one. But then I didn't like doing general pediatric practice in the United States because I liked working in public health. When I did my elective overseas in Bangladesh, when I was a pediatric resident, that for me was a life-changing experience. And because I had that experience when I was training, that said to me, that's really something that I felt that I wanted to do. That was what I enjoyed the most. And I pursued that. And that's how I wound up at CDC. So I think having a clinical background helped me then later moving into public health because I had a better understanding of what the health problems were. But I think you have to look and see what you want to do, what feels right to you, and then go from there.
For Peace Corps, we are always looking for those with a health background. Is it the most demanding field these days? I can't speak on that. I don't work in that sort of office that manages the program, but in the past, pre-pandemic, I think about 20% of those that joined us did pursue health roles. So it was one of our, not our largest, but maybe the second largest field pre-pandemic, of course. In terms of how I got into this field, it was by sheer accident. I studied linguistics and I was not really sure what path, but I wanted to do Peace Corps and I knew I wanted to do Peace Corps. And then I ended up working for the Peace Corps. So it was not my intention to work for the Peace Corps, but maybe it was the by accident part for me, and I do enjoy it. So thank you.
Thank you very much. I think we are running out of time, unfortunately. I wish I could sit here and ask you questions all day, but I know you have a very busy schedule. So this concludes today's Global Health and Humanitarian Organizations panel. On behalf of CULTR, I thank you for joining us. Thank you again to our three panelists, Dr. Dykewitz, Ms. Harris, Ms. Valadez, for your time, for sharing your experience, your expertise, some of the challenges that you have faced in your career as well, your beautiful stories of intercultural encounters. Thank you for a fascinating and enlightening discussion. Thank you as well to my co-moderator, Erica Denman,